Breaking tonight, the Obamacare numbers are out, and in the words of the architect of the president's signature legislative achievement, we are disappointed. Dr. Ezekiel Emanuel joins me live later tonight for round 2 of our spirited discussion. But first, welcome to the Kelly File, everyone. I'm Megyn Kelly. Just hours ago, we learned that the numbers appear to be even worse than originally reported. Less than 27,000 enrolling in the federally run exchanges. 27,000. As for the state-run exchanges that have been working much, much better, less than 80,000 signed up there. And we don't even know how many, if any, of these people have actually paid for the plans as opposed to saying they want them and putting them in the shopping cart. Meantime, taxpayer-funded health care is proving to be very popular. The Medicaid rolls spiking by nearly 400,000 people. Look at the disparity there. And then there is the biggest number of all. The now more than 5 million as of tonight Americans who have lost their health insurance, despite President Obama's pledge that if you like your health care plan, you can keep it, period. So now those 5 million and maybe more have roughly 30 days to find something, or they will start the year without any coverage at all come January of 2014. Mark Thiessen is a fellow at the American Enterprise Institute and a former speechwriter for President George W. Bush. So put these numbers in perspective for us, Mark.
So the White House bragged today that 27 million people had visited healthcare.gov since its launch, and 27,000 have signed up. That is a success rate, a sales rate of 0.1%. And Kathleen Sebelius had the nerve to say today that the marketplace is working. If they were in a real marketplace and they had that kind of a sales rate, they'd be going out of business. So this is not working in the least.
So now they are in a position where they have to get 5 million. That's the number we're reporting tonight have been canceled. They have to get those 5 million signed up for insurance before 1 month from right now, because if they don't get signed up by December 15th, then they don't have coverage come January 1st. They're out of coverage altogether. And according to our math, Mark, that means they need to have 156,000 signups a day for the next 32 days just to break even. That's not even counting the original 7 million they said they needed to make Obamacare work.
That's exactly right. And it's even worse than that, Megyn, because you're being very generous to them. The website isn't working, so they promised the American people, and President Obama, on November 6th, by the end of this month, we anticipate that it's going to be working the way it's supposed to. So by the end of November, they promised that the website would be working. So starting December 1st, everybody can go to healthcare.com. It's going to work just like Priceline, right? They have to have everyone signed up by the 15th in order to have coverage on January 1. So that's 15 days. That's 388,000 people a day they have to sign up. Wow. Even if the website's working perfectly. And it's not going to be. And
you may be being too generous to them in your comments, too, because today the chief technology officer that they've assigned now to look into this problem and work on the website testified before Congress. His name is Todd Park, and listen to this exchange.
You got to tell us when it's going to be in good shape. Can you date? Is the end of the month realistic?
The team's working really hard to hit that goal, and that's what I'm able to say right now, sir.
So to me, that as a former web developer, that's what I was telling clients when we were going to miss a deadline. We're working real hard to meet it.
So it may not be even ready to go come December 1st.
Nope. Kathleen Sebelius, health on November 6th. Healthcare.gov will be fully functional for the vast majority of consumers by the end of November. So this is the latest Obamacare promise that hasn't been kept. And look, we've got now 107,000 people who've supposedly signed up. Probably many of those are very poor and sick people who are going to lower the risk pool for Obamacare and make it more expensive. But a lot of those are probably people who are losing, of the 5 million, who are losing their plans. But that leaves, let's say they've signed up 107 million. That leaves 4.9 million people who've lost their plans, a net loss of 4.9 million people that they've got to make up before the end of the year. And the whole purpose of Obamacare was to cover the uninsured. They're not even going to make it to cover the currently insured by the end of the year.
And the real devastation is if people who had insurance, who have been canceled, cannot get on this website or get on and find the premiums to be too high, and January 1st comes and people who have real illnesses, serious illnesses, children with serious illnesses, find themselves uninsured when they were happily insured prior to this law. That is the true devastation. That is bigger than the collapse of a law. That is a societal disaster. Mark,
it's a
thank
life
you.
and death issue. Thank you.
Much